Good Friday morning. Bruce Williams here. Got a great cup of coffee in my hand, and it's time for this week's Growth Path Challenge. Today's questions come from the Descriptive Veterinary Pathology course, which the Foundation put on in 2012 on the campus of Louisiana State University, hosted by Dr. Fabio Del Piero. As I do at the beginning of all of my lectures, I want to thank those colleagues and friends who have made their images available through online collections or occasionally directly to me, which allow me to put these lectures and tests together. So get out your pens and paper, give yourself about 60 to 90 seconds for each question, and let's begin. Okay, this is tissue from a blank. I think that some organs are pretty obvious, so you should be able to tell where they're from. So mean Dr. Williams is not even going to give you what species this is from. And then I would also like for you to give me a morphologic diagnosis and a cause. All done? Okay. Well, these are kidneys from a cat. Cat kidneys tend to be golden in color because of the amount of fat that is present within the proximal convolute tubules, which are higher than most other species, so it gives them a characteristic golden color. And then you have these subcapsular vessels, which divide them often into 4 equal quadrants. So pretty easy to identify that these are from a cat. Now, we have multifocal coalescing white patches that are on the subcapsular surface of the kidney. Your two main rule-outs here, when you see a slide like this, and there are quite a few of them out there, would either be lymphoma or the mutated feline coronavirus, which becomes able to survive within macrophages and causes the condition known as feline infectious peritonitis. Because they tend to be a little flat, and because they are tracking these vessels, if you said that this is a multifocal coalescing pyogranulomatous renal vasculitis and nephritis, you are correct. Remember that FIP tends to be a vasculitis. It is a persistent coronavirus that the body can't clear, and so the body will continue to make antibodies against it. Eventually you get enough produced virus and antibodies so that these antigen-antibody complexes precipitate out of the blood into the walls of the vessels throughout the body. And the kidney is a very common spot, although you can see lesions throughout the body, within the abdomen, on the surface of the liver and spleen. And these white patches are generally largely composed of extruded fibrin and a mix of inflammatory cells, which is never the same. I always say that every case histologically looks a little different. Some are pyogranulomatous, some are lymphoplasmacytic, some are lymphohistiocytic. So I like the term varying combinations and concentrations of inflammatory cells when I look at these slides. So, great looking case of FIP. Okay, ready for another one? I think I need to give you a species on this one, so I'm going to tell you it's tissue from a horse. I would like a morphologic diagnosis and 2 clinical pathologic abnormalities, so findings that you would see that are abnormal in the blood work. Okay, your time is up. Hopefully you've been pausing this. I want to give you more than 5 seconds per. And we are looking at the hypothalamus, and compressing and elevating the hypothalamus, there is a well-circumscribed, somewhat darkly pigmented or hemorrhagic mass, and this is very characteristic for horses. This is a pituitary tumor, but not just any old pituitary tumor. Horses and rarely dogs get them in a small part of the pituitary known as the pars intermedia. So for full credit on this question, you would have to tell me that this is an adenoma of the pituitary pars intermedia. These tumors, due to their growth and what they release, cause a number of issues in horses. Their upward pressure on the hypothalamus causes disorders in appetite, in water intake, so these animals will drink a lot of water. They'll be polyuric, polydipsic. That is worsened by the wide range of hormones that these will release, which essentially cause a syndrome very similar to Cushing's disease in horses. They tend to be overweight. They tend to have trouble with the cyclic shedding of hair, so they often have very long hair. They're sometimes somnolent. And there is a significant association with laminitis and the metabolic syndrome. The two clinical pathologic abnormalities that you may see, I'll give you three. One would be hyperglycemia, one would be hyperinsulinemia, and the third would be hypercortisolemia. But there are probably a couple of others that you could name. Okay, ready for another one? Fantastic. Let's move on. This is a great picture from Dr. Donald O'Toole, and you can actually see him in the picture in the reflection from this animal's eye. This is tissue from a bison. I would like you to give me a morphologic diagnosis and a cause. Remember, the cause and the name of the disease are two different things. The cause is generally the etiologic agent that causes the disease, not what it's called in the literature. Okay, time's up. Bison are exquisitely susceptible to the disease known as malignant catarrhal fever. And the cause of this disease is a wide range of viruses that are carried by ruminants, which cause no problems within the natural host, but when they jump to another host, cause a significant lymphoproliferative disease. The most common cause of this in bison in the United States is ovine herpes virus type 2, and this can be a problem whenever bison and sheep are housed in the same area. Maybe the bison are housed in a place where sheep were previously housed, or kept even in the same sale barn, because bison are so exquisitely susceptible to this disease. There are gamma herpes viruses that cause malignant catarrhal fever and a number of other ruminants, so potentially this could be the result of keeping bison and wildebeest together, keeping white-tailed deer. Many different ruminant species have this. In the bison, the gamma herpes virus causes a profound lymphoproliferative disease, and one of the characteristics of this condition is the presence of large numbers of lymphocytes in and around vessels, causing vasculitis throughout the body. One of the characteristic signs of the head and eye form, and there are 4 forms of this disease, but the head and eye form is characterized by corneal edema and anterior uveitis. And this bluish cast is very characteristic of this. There is an anterior uveitis, and there is inflammation in the anterior segment, damage to the endothelium of the cornea, and corneal imbibition of fluid and edema. So this blue cast is really corneal edema, and hopefully you realize there's an anterior uveitis behind it and causing it, and we can even see that the scleral vessels are markedly injected and dilated. Another very photogenic part of the head and eye form of malignant catarrhal fever is a profound purulent discharge from the nose. So, malignant catarrhal fever, remember, the bison are exquisitely susceptible to this particular disease. Slide number 4 is tissue from an ox. I would like a morphologic diagnosis and a cause. Okay, time's up. You probably could have given me a number of causes on this one, but we're looking at the lungs of an ox. You can see that the inflammation is primarily confined to the cranioventral area. So this would be bronchopneumonia rather than interstitial pneumonia. And my morphologic diagnosis is multifocal to coalescing suppurative bronchopneumonia with bronchiectasis. All of these sort of golf ball looking structures are airways which are filled with pus. And because of the damage that all the neutrophils exploding have created within the airway, you've lost the elastin within the wall. They've been significantly remodeled. They'll never go back to normal. They will always be bags of pus for the rest of this animal's life. Okay, you could probably put a number of agents, bacterial agents associated with the bovine respiratory disease complex, in your as a cause for this. I'm very happy with Mycoplasma bovis. That's one that really causes this particular condition with the suppurative bronchiolitis and bronchiectasis, because Mycoplasma zeroes in on anything with cilia, so those are going to be the airways. The first thing that they do is cause ciliostasis. They eradicate the mucociliary escalator. Then they draw in a lot of neutrophils, setting up this lesion. Finally, their superantigen will cause profound bald hyperplasia. It's a very characteristic lesion, and that will be a great one. But if you said any of the other bacterial agents associated with the bovine respiratory disease complex, which would include 3 agents which were previously classified as Pasteurella, have been renamed over the years, Mannheimia hemolytica, Pasteurella multacida, or even Biebersteinia triolosi, which used to be Pasteurella triolosi. I'm going to give you credit. I'll also throw in Mycoplasma mycoides, and I think I could probably accept Histophilus somnus. But the ones that really, really like to cause this suppurative bronchiolitis with bronchiectasis, I'm going to say Mycoplasma, top of the list, Pasteurella, now Mannheimia hemolytica, number 2. Hey, if you stick a culturette in here, I bet you're going to get Truparella pyogenes, because these are long-standing areas of abscessation, and Truparella is a great secondary invader. Okay, we're halfway home. Here's slide number 5. This is tissue from a foal. Can you give me the morphologic diagnosis and name the condition? Just for fun, so you can show off, why don't you give me the genetic defect associated with this? Okay, time's up. A couple things that we need to notice about this foal. It is a white foal, and that's going to be very important. The name of this condition is lethal white foal syndrome, and it is due to a defect in the endothelin B receptor, which causes a lesion that will suffice for the morphologic diagnosis. Note that the small colon is very small. It's way too small. The lumen is patent. It's formed, but it just does not assume a size or develop to a size which allows for passage of ingesta. So everything prior to this is full of ingesta. Not so much here. I don't think this animal lived for too long. But had it lived, these animals usually die of a raging colitis, because they just can't pass the feces. The morphologic diagnosis and the defect associated with this is colonic hypoplasia with aganglionosis. Remember that this type of color defect is really a birth defect, and you can have a lot of other problems associated in albino animals with defective migration of tissues in the developing fetus from the neural tube to their other places in the body. And the aganglionosis is associated. It is a neural part. It causes the innervation and ultimately the development of that segment of the intestine. So if it doesn't form properly, that segment of colon will not form properly. So this is the basis of the lethal white foal syndrome. Slide number 6 is from a dog, obviously a puppy. I would like for you to give me the morphologic diagnosis and give me a likely breed. Okay, time's up. Listen up here. This is a disease called lissencephaly. Lissencephaly. Note that the normal number and size of gyri and sulci are not here. There are a number of macrogyri and a few sulci. Essentially, the convolutions of the brain are far fewer than normal. It could be absolutely smooth. This one has a couple. This condition is known as lissencephaly. Lissencephaly is most often seen in brachycephalic breeds such as Lhasa Apsos, Malteses, and Shih Tzus. And the disease is much more than just a reduction in the number of gyri and sulci. When there is this level of gross abnormality, the microscopic abnormalities are profound because the neurons don't get into the normal areas of the brain. So it's really not considered something that is compatible with a long life. It is due to a defect in the formation of a number of chaperone proteins. Proteins with the names like LIS1 and relin and double cortin. And there are a couple of these. And what these proteins do is they attach themselves to the developing neurons and they direct them to the correct places in the brain. And that does not happen here. There's a lot of miswiring of these brains. Now, there are a number of animal species, especially when you get down to birds, anything lower on the phylogenetic tree, birds, reptiles, fish, generally don't have the gyri and sulci, so their brains will normally be smooth. And then there are a couple of mammalian species, I believe marsupials, a couple of them may have somewhat smooth brains, but generally when we think about our typical mammalian species, they should have a number of convolutions on top of the brain. Slide number 7 is from a duck. Can you give me a morphologic diagnosis and a cause? Okay, time's up. We're looking at the heart. It would appear that the pericardium has been removed, so we're looking at the epicardial surface and a fair amount of fibrin within on the surface of the epicardium, potentially within the pericardial space. If you look really closely, you are going to see little areas of hemorrhage, probably is the source of this fibrin. Morphologic diagnosis would be a diffuse fibrinous epicarditis with hemorrhage. And whenever you see fibrin in the potential spaces of the body, such as the pericardial space, also within the pleural space, in the peritoneum, on the surface of the visceral organs, in the meninges of the joints, this is very characteristic of sepsis, bacterial sepsis. In ducks, there's a condition known as new duck disease, and it's not that the condition is new, it's been known for 75 years or more, but it affects young or quote-unquote new ducks. It is caused by a bacteria that is known as Rhimarella anatopestifer, anata meaning duck, and before it was called Rhimarella, it was called Pasteurella. We're doing a lot of Pasteurella today, it seems. And Pasteurellas generally cause a significant sepsis. Think of fowl cholera. And there's often a lot of hemorrhage associated with it, with once again, think of fowl cholera or Pasteurella multocida, where one of the classic lesions is going to be hemorrhage throughout the body. So we see the vasculitis here. We see the fibrin within the pericardial space, and that should give you a very good clue as to the pathogenesis of this. And it is very much associated with pasteurellosis in birds. So they renamed this one Rhimarella, but new duck disease, Rhimarella anatopestifer. Okay, 3 more slides to go. This is tissue from an ox. There are 2 morphologic diagnoses that I would like for you to give me. A great picture from Dr. Mario Cagnati at the University of Milan. Okay, time's up. This is the liver from an ox. Sort of difficult to tell because we're up close, but the first morphologic diagnosis, look at the overall color of the liver in between these areas of blood accumulation, and it is orange. And so this animal has hepatic lipidosis, which is great because it really makes this second lesion pop. And the second lesion are these depressed areas in which there's accumulation of blood. This is a incidental finding that is fairly commonly seen in cattle at slaughter, and it is known as hepatic telangiectasis. Nobody's really ever been able to prove what causes this, but you have loss of hepatocytes, you have accumulation of blood, which seeps in and fills these areas. And whether you want to call this congestion or you want to call this hemorrhage, I never figured out which one it is. It looks a little like hemorrhage, but nobody knows what causes telange. A lot of people think that it might be due to previous bouts of sepsis and bacteria coming out of the GI tract through the portal system into the liver, causing some necrosis. And then those little areas slough away. Because of the presence of the blood, maybe they don't reform. You know, the liver can really regenerate. So it's always a fun lesion. A lot of people want to look at that and they want to attribute a lot of pathogenesis. They want to say, oh, it's hemorrhage or it's necrosis or something. But hepatic telangiectasis. Some people call it telange or sawdust liver. Slide number 9 is tissue from a cat. Can you give me a morphologic diagnosis and a cause? Okay, this is one that you might have read in books. It's more of a historical condition. We don't see it anymore. And we're looking at the skull of this cat, and you can see these large areas of proliferation of the bone. These might started out as exostoses. At this point, they are multiple cranio-osteosarcomas. If you want to call them osteochondromas or chondromas, I will give you partial credit, but at this point, they're usually considered to be malignancies, and they are osteosarcomas. And it's like, well, what causes osteosarcomas? Well, this is a condition that historically was associated with feline retrovirus, the virus that causes feline leukemia. Back in the day, it would cause FOCMA-positive sarcomas on the flat bones of a small number of affected cats. And when it first came out, it was called feline sarcoma virus. But people over time realized it is just part of the family of the feline leukemia virus. And now that we vaccinate for this condition widely in the United States and in Europe and most parts of the world, we don't see this particular lesion anymore. It's gone the way of most of the tumors associated with feline leukemia. we still see a couple of associated lesions, but this one is pretty historical. I don't know if in parts of the world where they don't vaccinate for feline leukemia, this is still seen. But boy, I haven't seen one in years and years and years and years. Okay. Slide number 10. This is tissue from a dog, and I would like for you to give me a brief pathogenesis. Let's say, 4 concepts separated by arrows is the best way to put that one down on your paper if you've never done this before. So, pathogenesis. Okay, time's up. This is a condition which is known as hypertrophic osteopathy. And the pathogenesis is typically that there is a proliferative disease often within the thorax. That could be a lung tumor. That could be diffuse or focal granulomatous disease, like you might see with some of the dimorphic fungi. And occasionally this has been identified in association with tumors in other parts of the body. But in the dog, let's stick with a large mass lesion within the thorax. Now, I'm going to give you the pathogenesis that's in the books. There are a couple of possibilities. It hasn't been totally sorted out yet, but this mass lesion is going to cause irritation to the vagal nerve, which ultimately results in hypertension at the level of the periosteum of the metacarpals, the metatarsals, and distant. You have enhanced blood flow, which triggers periosteal new bone growth. Now, people have been able to show this happens by cutting the vagal nerve, putting a mass lesion, cutting the vagal nerve, and this does not form. I don't know if it's totally worked out yet. It certainly is a well-known entity, and that's probably about as good as the explanation has gotten in the last 40 or 50 years of research into this. So, that is slide number 10. That completes this week's Growth Path Challenge. I hope you enjoyed that. I hope you'll go back and look on our YouTube channel where we have 11 previous Growth Path Challenges. We'll be back next Friday with another one. I hope everyone has a fantastic weekend, and thanks for tuning in.